Hey everyone, it's Dr. Crystal from Portsmouth, New Hampshire. And today I want to talk to you about the experience when you come in to see me for pelvic care services. So, first off, before you even come in, I'm going to have you fill out a health history form. And that health history form is going to include information about your medical history from a Western or allopathic viewpoint and ask you some questions about what's going on with your symptomology, your condition, and in particular, your condition over time. And from there, we'll also have you look at some of the patterns or energies that you might be experiencing related to whatever pathology that might be. So, for instance, you might answer questions about heat and cold and the type of sensation that you're feeling, as well as some other considerations for how the symptoms sort of come together. And that's looking at things from a Chinese medicine perspective. In Chinese medicine, we like to look at the whole picture. We like to look at the source of what the pathology might be. The symptom or the pathology itself may be urinary retention, but the cause could be kidney yang deficiency. And that might not be something that you understand, and you don't necessarily have to understand that right now. But we want to know what's happening in the deeper systems of your body, because that gives us information about how the organs are communicating with each other and how they might be presenting. And I think by layering that Western approach with the Eastern approach is how we can be successful in treating the majority of pelvic health concerns. Okay, so after you fill out your health history, you're going to come in and we're going to sit down together. We're going to have a chat. You can have a glass of water or some tea, and we'll kind of chat about what's going on, what your goals are, set some realistic expectations. And I'm also going to provide you with some education about the pelvic floor. Now, if you're here, you might have already seen that I did a little bit of an anatomy video for those of you that are new to me or getting a feel for what I do. So that's a great start. But we'll talk about the anatomy related to your condition and get super specific with what your presentation is. Because after all, we can see 100 pelvic care cases and they'll all be a little bit different. And it's super important that we understand the nuances of what's happening in your body to treat you successfully. Okay. So after we go over some anatomy and sort of get an understanding of the whole picture, what I want to do then is palpate. And that means that I'll have you kind of stand up on your bare feet, which is really important. Stand up on your bare feet, and I'll get a sense of how your pelvis feels, what it's like in the standing position from the front, from the back, from the sides. And I may or may not have you kind of move around and see how that feels and what that does. I'm also going to get a feel for those muscles up your spine to see what they're doing, and maybe even the abdominal muscles. From there, generally, once we get a feel, we'll put you on the table and we'll do our palpation again on the table. And right now, this palpation is mostly looking at the concomitant structures. And what I mean by that is the big muscles. So the muscles of the glutes, the posterior rotators of the hip. We'll look at the back, we'll look at the abdomen, maybe even the hips, because that provides us with a lot of information about what's happening with the body. Right? And also those big muscles, if they have imbalances in them or we have a bony imbalance, then it's really hard to just go right to these little muscles of the pelvic floor and think we can make a difference by working with those muscles versus starting with the bigger ones. So I like to start with the bigger ones. And I'll generally palpate those with you on your back and then on your stomach as well. After that, if you're comfortable with it, and everything that we do is consensual. So if you're comfortable with it, I'll palpate the pelvic floor. And I can do this with your underwear on, or I can do it with gloves on if you don't have your underwear on. It really depends what your preference is and where we're going to go on that first day. And what we'll do, you'll be on your side. So you'll be able to have your knees together, and we'll be able to keep the genitals covered and out of sight, out of mind, right? And so you'll be on your side, and I'll be able to palpate. See, this is the tailbone, this is the sacrum, right? So you'll be on your side like this. This is that external anal sphincter here, this guy. And then I'll be able to go next to that to palpate the muscles of the levator ani. And then I'll move forward and I'll go right along this bone here, the pubic bone, to feel into the transverse peronei and to feel into the ischiocavernosus muscle. If you're male, I'll also palpate the bulbospongiosus muscle, which is cut here at that time. Now, if you're a female and you have some serious pelvic health concerns and you're comfortable with it and it's consensual for you, then what we might do is move you onto your back or move you back into standing and do an internal examination to see what those muscles feel like from the inside. A lot of times I don't do this on the first day. And the reason that I don't do it on the first day is because I want you to feel super comfortable with me. I want us to develop rapport and for you to feel safe before we even begin, right? Getting into these really intimate areas. And safety is key because so many emotions are held in this area. So it's really, really important for us to kind of look at that. So that's always something that can be tabled until later. And there's a lot that we can do before we even go to the pelvic floor. And I think that's really, really important for us to remember is that we can make change without going right into an internal examination or an internal change. So from there, depending on what we decide, we'll begin with some treatment. And as an acupuncturist and a PT, I generally work on the first day from a place where we lay a foundation. So that place can include clearing your energy field, getting used to what needling feels like, especially if you haven't had acupuncture before. So we kind of get a baseline there, clear the emotions, kind of create a foundation, and then we'll move toward looking at what your pulses say. And the pulses and the tongue also give us information about the source of the dysfunction, right? And so we'll clean up anything that we find in the pulses that might be giving us some insight as to how the internal body is producing what's happening on the external body or vice versa, right? And then after we do that, we might get into some treatment, depending how much time we have left, we might get into a little bit of treatment of something that we found structurally or something that came up emotionally. So if we found something structurally where, let's say we've got this piriformis muscle here. Let's say that piriformis muscle on one side is really, really tight, and on the other side, it's really slack and really, really weak. We might try to relax this muscle. And we could do that with some muscle-specific Ashi point needling or dry needling, as it's commonly called. We can also do some cupping or some moxa or something like that to try to start to release the structure. Okay, so there's often a lot of kind of flip-flopping on the first day and multiple sort of short treatments that roll into what we're doing. And that's so that I can get a feel for your energy, how it moves, and you can get a feel for how I work and how I apply the needles so that we can move forth. At the end of the first session, I'll generally give you some like lifestyle recommendations or tips that you can bring home to utilize. And I always like to make my lifestyle recommendations things that you can carry out easily. So for instance, if you are not somebody that is going to be able to take supplements, then that's not going to be on my recommendation list. But if you are somebody that is going to do a breathing exercise or is going to work with a physical exercise, somebody that likes to go to the gym and do different exercises and things like that, then that'll be a time when we can talk about how to bring the pelvic floor in or how to bring that pesky piriformis in with a stretch or a foam roller or something of that sort, depending upon what your vibe is. So at the end of the day, in the experience here at Pure Balance, everything is geared toward you. I just want to tell you real quick how I got into pelvic care. And honestly, I've been doing pelvic care since 2009. And this was really before this was a mainstream conversation. It's so awesome that it's a mainstream conversation today, or at least more of a mainstream than it was, right? But when I started, it wasn't. And people weren't really talking to their providers, their practitioners about what was happening in their bodies and particularly in their pelvis. And they would come to me for whatever they might have been coming in for. So it could have been an ankle sprain, it could have been a low back, low back got thrown out, could have been a neck thing, could have been a whatever pain thing. A lot of people, when I first started, saw me just for pain. That was my big thing. But it also could have been digestion. And then all of a sudden, people started really opening up about their pelvic health. It was like, hey, you really helped my back pain. Like, it has transformed my life. And also, I've noticed a little bit of improvement with this other thing, which is my urinary incontinence. And I wanted to know, is there something more specific that you can do for urinary incontinence? And at this time, there weren't really programs out there that were, going hard and heavy in teaching about pelvic health. So I did research and more research and more research. And I started experimenting with the clients that came in to see what worked to support them and their pelvic floors. And it was really, really rewarding work because it was so sacred that clients trusted me to be with them. They trusted me as their healthcare professional that was going to be compassionate at the very least in a space of unknowns. And then if we were able to make some progress, which very often we were, it was like, okay, this is great. We're starting to transform this really underserved population. And we're starting to make waves in a type of client, in a type of healthcare that really isn't yet talked about. And that's where my passion started. And I brought it into practice over time. And it's really been amazing to be able to help people like you with their pelvic health.